You're lying on the operating table. The anesthesiologist tells you to count backward from 10. 10, 9, 8, and then nothing. You're out cold, right? Well, what if I told you that for some folks, the lights never really go out? What if you could hear everything, feel the pressure of the scalpel, but couldn't move a single muscle to let anyone know you're awake? Sounds like a nightmare, doesn't it? But here's the kicker, it's way more common than you'd think. And trust me, once you hear what happens when anesthesia fails, you'll never look at surgery the same way again. So buckle up, because we're diving deep into one of the most terrifying medical experiences a person can face. And let me tell you, it's enough to make your skin crawl. The silent scream. Nobody hears picture this. You're wide awake. You can hear the doctors chatting about their weekend plans. You feel the cold touch of surgical instruments on your skin. The pressure builds as they make the first cut. You try to scream, try to move your hand, wiggle your toes, anything to signal that you're conscious. But nothing happens. Your body won't cooperate. It's like being trapped inside a coffin while still breathing. This is called anesthesia awareness, and it's every patient's worst fear come true. You'd think with all our fancy medical technology this wouldn't happen anymore, right? Wrong. Dead wrong. Studies show that about 1 or 2 people out of every 1,000 surgeries experience some level of awareness during the procedure. Now, that might not sound like much, but when you consider how many surgeries happen every single day around the world, we're talking thousands of people every year who wake up on the operating table. Can you imagine that? Being fully conscious while someone's cutting into you? Makes you want to stay far away from hospitals, doesn't it? Why does this happen anyway? Alright, so you're probably wondering, how the heck does this even happen? I mean, isn't the anesthesiologist's whole job to keep you knocked out? Well, here's the thing. Anesthesia isn't a one-size-fits-all deal. Different people react differently to the drugs. Some folks metabolize anesthesia faster than others. Maybe you've got a higher tolerance. Maybe the anesthesiologist made a tiny miscalculation with the dosage. Or maybe, and this is the scary part, the equipment monitoring your anesthesia levels malfunctioned. There's also something called the light plane of anesthesia. Sometimes, to reduce risks, doctors keep you in a lighter state of unconsciousness, especially during certain types of surgeries. The problem? That's exactly when you're most likely to wake up. And get this, emergency surgeries are the worst. When doctors are rushing to save your life, they don't always have time to fine-tune your anesthesia levels. So you might end up somewhere between awake and asleep, stuck in this horrifying limbo where you can't move but you're aware of everything happening to you. Pretty wild, huh? Makes you wonder how many times this has happened to people who never even knew it. What does it actually feel like? Now, let's talk about what patients actually experience when this happens. Because, trust me, it's worse than you can imagine. Most people who've been through anesthesia awareness say they felt paralyzed. And I'm not talking about the kind of paralysis where you just can't move for a bit. I'm talking about complete and total helplessness. You're screaming inside your own head, begging someone to notice, but your body's like a prison you can't escape from. Some patients report feeling pain, real gut-wrenching pain. Others say they didn't feel pain exactly, but they felt pressure, tugging, pulling, like someone's rummaging around inside them. Imagine feeling your ribs being spread apart during heart surgery, or sensing the drill during dental work, but being unable to tell anyone to stop. And here's where it gets even creepier. A lot of patients say they could hear everything. The beeping of the monitors, the doctors discussing the procedure, sometimes even jokes or casual conversation. One woman said she heard her surgeon complaining about his golf game while operating on her. Can you believe that? But the absolute worst part? The panic. The sheer terror of not knowing if you'll ever be able to move again. Some people thought they were dying. Others wondered if this was what being dead felt like. That's enough to mess anyone up, don't you think? The psychological aftermath nobody talks about. So let's say you survive the surgery. You wake up properly afterward, everything went medically fine, and the doctors pat themselves on the back for a job well done. But you're traumatized. See, most people don't realize that anesthesia awareness doesn't just end when the surgery's over. The psychological damage can last for years, sometimes forever. We're talking about post-traumatic stress disorder, anxiety, depression, and a whole bunch of other mental health issues. Patients who've experienced this often develop a crippling fear of medical procedures. Some refuse to have necessary surgeries because they're too terrified it'll happen again. Others have nightmares for months, reliving that moment when they realized they were awake on the operating table. One guy I read about said he couldn't sleep properly for over a year. Every time he closed his eyes, he felt like he was back in that operating room, paralyzed and helpless. His marriage fell apart. He lost his job. All because of those few minutes when he was aware during surgery. And here's the kicker. A lot of doctors don't take it seriously. They'll tell you it was just a bad dream, or that you're misremembering things. But patients know what they experienced. They know it was real. And being dismissed like that just makes the trauma worse. What do you think about that? Doesn't it make you want to shake some sense into those doctors? The stories that'll keep you up at night. All right, let me share some real stories with you. These aren't made up. These are actual accounts from people who've been through this nightmare. There was this woman having a cesarean section. She woke up right as they were cutting into her abdomen. She felt everything. The scalpel, the pressure, the tugging as they pulled her baby out. She tried to scream, tried to move, but nothing worked. She said it felt like an eternity, even though it was probably just a few minutes. The worst part. She heard her baby's first cry while still paralyzed on the table, unable to hold her newborn or even let anyone know she was conscious. Then there's the guy who woke up during open-heart surgery. He could hear the saw cutting through his sternum. He felt his ribs being pried apart. He thought he was going to die right there on the table. He later said it was like being tortured, except nobody knew they were doing it. How messed up is that? Another patient woke up during eye surgery. She couldn't move, couldn't blink, couldn't close her eyes. She just had to lie there while they operated on her eyeball. She described it as the most violating experience of her life. And the crazy thing? The doctors had no idea she was awake until after the surgery when she told them what happened. These stories give you chills, don't they? Makes you wonder how you'd handle it if it happened to you. How common is this really? Now, before you swear off surgery forever, let me put things in perspective. While anesthesia awareness is terrifying, it's still relatively rare. Like I mentioned earlier, we're looking at about 1 to 2 cases per 1,000 surgeries. Those aren't terrible odds, right? But here's where it gets interesting. Certain types of surgeries have higher rates of awareness. Cardiac surgery, emergency procedures, and cesarean sections tend to have more cases. Why? Because these surgeries often require lighter anesthesia to protect the patient or the baby. Also, if you've got a history of anesthesia awareness, you're more likely to experience it again. Your body might just metabolize those drugs differently. And if you're a heavy drinker or drug user, your tolerance to anesthesia might be higher, which means you need more of the stuff to stay under. Plus, let's be honest, not all hospitals and anesthesiologists are created equal. In places with less experienced staff or older equipment, the risk goes up. So if you're having surgery at some tiny clinic in the middle of nowhere, you might want to think twice. But even in the best hospitals with the best doctors, mistakes happen. Equipment fails. Calculations get messed up. And sometimes, through no fault of anyone, your body just decides to wake up at the worst possible moment. Scary thought, isn't it? Can anything be done to prevent it? Okay, so now you're probably freaking out a little. Don't worry, there are things that can be done to reduce the risk. Not eliminate it completely, nothing in medicine is ever guaranteed, but definitely reduce it. First off, there's something called a brain activity monitor. It's like an EEG that measures your level of consciousness during surgery. If you start waking up, The monitor alerts the anesthesiologist, who can then adjust your medication. Not all hospitals use these, but they should. Studies show they can cut the risk of awareness by more than half. Second, make sure you tell your anesthesiologist everything. And I mean everything. If you drink, if you use recreational drugs, if you've ever had problems with anesthesia before, spill it. The more they know, the better they can tailor your anesthesia. Don't be embarrassed. Trust me, they've heard it all before. Third, don't be afraid to ask questions. Ask about the monitoring equipment they'll be using. Ask what the plan is if you start to wake up. Ask about their experience with your particular type of surgery. A good doctor won't mind answering these questions. If they get defensive or brush you off, that's a red flag. And finally, if you're really worried, you can request what's called a depth of anesthesia monitor. Not all places have them, but it's worth asking about. Bottom line, be your own advocate. Don't just trust that everything will be fine. Make sure the people putting you under know what they're doing. What do you reckon? Would you grill your anesthesiologist before going under? The legal side of things. Here's something that'll really get your blood boiling. Even when anesthesia awareness happens, getting justice for it is incredibly difficult. See, to win a malpractice case, you have to prove that the doctor was negligent. But here's the problem. Anesthesia awareness can happen even when everyone does everything right. So unless there's clear evidence that someone screwed up, you're out of luck. And even if you can prove negligence, you have to show that it caused you significant harm. But how do you quantify psychological trauma? How do you put a price tag on nightmares and anxiety? Some judges don't even consider it real harm because there's no physical damage. Plus, many hospitals have mandatory arbitration clauses buried in the paperwork you sign before surgery. That means you can't even take them to court. You have to go through arbitration, which almost always favors the hospital. It's a rigged system, if you ask me. You go in trusting these people with your life, and when they mess up, you're left dealing with the trauma on your own while they face zero consequences. One patient spent years fighting for compensation after waking up during surgery. She had PTSD, couldn't work, and her whole life fell apart. And you know what the hospital offered her? A measly few $1,000s. Like that's supposed to make up for everything she went through. Makes you sick, doesn't it? What happens when you try to tell someone? You'd think that if you woke up during surgery and told the doctors afterward, they'd take it seriously, right? Wrong again. A lot of patients report being dismissed or not believed. Doctors will tell them they were just dreaming, or that it's a side effect of the medication. Some even suggest the patient is lying or exaggerating for attention or to build a lawsuit. This is what they call gaslighting, and it happens way more often than it should. The patient knows what they experienced was real, but the medical team refuses to acknowledge it. And that just adds another layer of trauma on top of everything else. One woman said she told her surgeon she'd been awake during the procedure. He laughed it off and said it was impossible because the monitors showed she was fully under. But she could repeat word-for-word conversations that happened during the surgery. She knew details about the procedure that she couldn't have known otherwise, and still he wouldn't believe her. That kind of dismissal can be just as damaging as the awareness itself. It makes patients feel like they're going crazy, like they can't trust their own memories or perceptions. And here's the really messed up part. Some hospitals actually train their staff to downplay or deny anesthesia awareness claims because they're worried about lawsuits. So they'll do everything they can to convince you it didn't happen, even when they know darn well it did. How's that for bedside manner? Moving forward, living after the nightmare. So what happens to people after they've been through this? How do they move on? Well, it's not easy. Some people need years of therapy to work through the trauma. They have to learn how to trust doctors again, how to not panic at the thought of medical procedures, how to sleep without nightmares. Support groups have popped up for people who've experienced anesthesia awareness. Talking to others who've been through the same thing can be incredibly healing. It helps to know you're not alone, that other people understand what you went through. Some patients become advocates, pushing for better monitoring equipment and stricter protocols. They share their stories publicly, even though it's painful, because they want to prevent others from going through the same nightmare. And you know what? That takes guts, real courage. To take something so traumatic and turn it into a mission to help others? That's pretty incredible if you ask me. But not everyone can do that. Some people never fully recover. They carry that trauma with them for the rest of their lives. And that's okay too. There's no right way to deal with something this horrific. The important thing is that we acknowledge it happens, that we believe the people it happens to, and that we do everything we can to prevent it from happening again. Because at the end of the day, nobody should have to experience what these people went through. Nobody should have to feel that kind of helplessness and terror. Don't you agree? So there you have it. Waking up during surgery isn't just some urban legend or rare freak occurrence. It's a real thing that happens to real people, and it can mess you up in ways you never imagined. The next time you're headed into surgery, you'll probably think about this. And honestly, that's not a bad thing. Being informed, asking questions, advocating for yourself, that's how you protect yourself in a system that doesn't always have your back. Stay safe out there, folks. And if you ever do wake up on that operating table, just remember, you're not crazy, you're not alone, and it's not your fault.